So as mentioned, Metro Rehab Hospital has specialised services for stroke survivors. We specialise in neurological rehabilitation, so to do with the brain. So if you're considering additional rehabilitation, you might wish to consider Metro Rehab Hospital. So we're a boutique private rehabilitation hospital located in Petersham, so Sydney's inner west. Our team work with you on personalised multidisciplinary goals, so each person's plan is different, unique to them. We specialise in neurological rehabilitation, including stroke recovery and prevention, other neurological conditions such as Parkinson's disease, so we offer a PD warrior program, and recovery after brain and spinal surgery. We also have other programs including orthopaedic and musculoskeletal rehabilitation, reconditioning programs, cancer rehabilitation, pain programs, and cardiac or heart rehabilitation. So we offer both inpatient and outpatient services. So either you stay in the hospital or you come from home or your residential aged care facility. Our inpatient services are for stroke survivors who have had a new stroke or those with changes in function. So for example, if you've been having more falls. For those people who are finding that they're now a little bit less safe or unsafe at home, or who would benefit from daily support and really intensive rehab, so every day. We offer 24/7 nursing care and an intensive 7-day therapy service, so including the weekends. We also have nutritional catered meals cooked on site, so we get a lot of great feedback about our hospital food. Our outpatient services are for stroke survivors who are well enough to live in the community, but want to improve their abilities and function. So we have a day program, which is multidisciplinary care with a doctor, so including your allied health professionals like physiotherapists, occupational therapists, speech pathologists, individual therapies, so one-on-one, and group programs where you might meet other stroke survivors as well. So the day program is primarily through private health insurance, but there are some fee-paying options. We also have Metro Rehab therapy services, okay? So this is the one where even if you don't have private health insurance, you can come and access the services and you'll still be under a rehabilitation doctor. We also have services to support people who are on NDIS plans, including improved daily living, assistive technology, and improved health and well-being. Now, we have a special neuro rehab clinic. It's also called the Sydney Stroke Centre. So that's for people who have long-term neurological conditions, and that includes people who have had a stroke, so stroke survivors who have ongoing concerns. So you'll get assessment with a rehabilitation specialist, that's Dr. Lee on the slide there, and those are bulk billed through Medicare. Now, Dr. Lee and one of our other doctors, Dr. Redmond, provide a spasticity service. So that includes Botox injection and then therapy to support the use of those injections. You'll also receive ongoing support from the Neurological and Rehabilitation Care Coordinator, and that's me. So I mentioned a multidisciplinary team before. I'm going to talk about them and the equipment and facilities that we have on site. So our medical and nursing team include rehabilitation specialists, a neurologist, pain specialist, rheumatologist, our registrars, so our doctors who are on site Monday to Friday, and rehabilitation nurses. Now, we have occupational therapists and their equipment. So occupational therapy is primarily about improving the use of your arms, but also about improving your ability to do things. So your activities of daily living, such as showering, potentially gardening, okay? So those sorts of things that you need to do, but also that you want to do. So our occupational therapists also have access to specialist equipment, such as the MediTouch and the SmartFit, which you can see down the bottom on the right of the slide. Now, they allow our occupational therapists to design personalised, gamified programs for stroke survivors with arm or upper body, sight, cognitive or thinking impairments. And they can also be used to help in other areas, such as balance, depending on how they're set up. We also have special equipment such as a Sabo Flex. So that's used on the upper limb or the arm. And it helps to support the arm so people can practice grasp and release training. Now we have a well-equipped gym with the physiotherapists. Now the physiotherapists look more at those larger movements, okay? So when you're looking at things like balancing, standing, walking, things like that. Now the physiotherapists have access to a lot of equipment. So a tilt table to train standing and putting weight through your legs when stroke survivors can't stand on their own. It also helps to train postural control. So making sure that you can actually sit upright first, and can be used in the spasticity management we talked about with the Neuro Rehab clinic. They have an ergo trainer, which you can see on your screen. So it's basically a machine that moves on the ceiling, and the stroke survivor would sit in a harness, okay? So it carries the body weight. So you can exercise or do your program with or without a treadmill with little risk of falls. Well, you can't fall. So it can be used to help with practicing standing, putting weight through your legs, and gait retraining, so walking correctly. We also have a Thera trainer, so like an exercise bike for your arms and also for your legs. So that is going to improve your range of movement, your strength, and your cardiovascular fitness. There are also electrical stimulation devices such as the Bioness and WalkAid, and that can help for people who have difficulty managing their foot. So if their foot is dropping, for example. We also have exercise physiologists up in the gym. Okay, so you can see one of our stroke survivors merrily practicing away there on the left-hand side of the screen. So primarily exercise physiology is about improving general health and well-being through exercise. We have a very nice heated hydrotherapy pool. Okay, so again, if people are appropriate for hydrotherapy, they're able to access that. And the physiotherapists, exercise physiologists, and occupational therapists may make use of the hydrotherapy pool with the stroke survivor. Unlike many sites, we have access to speech pathology, dietetics, and music therapy on site. Okay, so they provide individualized on-site support for communication and swallowing, nutrition, and health and functioning and well-being through music. We also have psychology and social work. So they're to help your mental health and well-being or supportive counselling and linking you into services to support you at home. Now, some of your therapists, if you're here in the inpatient stay and then go through to outpatients, you'll see the same therapist, okay? So they continue your care. As I mentioned, we've got our care coordinators. So what we do, you've got Brittany, myself, and Caleb on the screen there. We assess people's needs and support the transition to rehab, so even before people step through the door. We also facilitate communication between stroke survivors, families and the treating team. And at the moment with COVID, even though we can't have visitors to the hospital, we're doing FaceTime sessions with family, okay? So patients can still see their relatives and communicate with them and stay in touch. We also do education and advocacy. So you might do the My Stroke journey or discuss preventative stroke management. And I follow up with you once you've left. So even when you finish your rehabilitation program, we know that people need ongoing support, or they really like it and appreciate it. It helps with that prevention. So I'll be in touch even after you leave. So apart from all those reasons, why choose Metro Rehab? As I mentioned, we work on personal goals important to you. Our full multidisciplinary team is specialised in neuro rehab. We have rehabilitation specialists and a neurologist on site. We have best practice therapies and equipment, and implement the clinical guidelines for stroke management and participate in National Stroke Foundation audits to continually improve our practice and care. We also have certification against the National Safety and Quality Health Service Standards. So it's a high quality service. Now that we're proudly owned by Royal Rehab, apart from the equipment we already have on site, we have access to Royal Rehab technologies through their tech hub. So like the robotic exoskeleton you see on your screen, and links into specialist services such as the sexuality service at Royal Rehab. We also have online education and events. So we recently hosted a series of United with Metro webinars on topics of interest to stroke survivors, like stroke prevention. Do events in partnership with organisations like the Stroke Recovery Association. We had a Move with Metro event. And we do fundraising for the Stroke Foundation. So for example, our staff participate in Stride for Stroke. And our patient feedback, this is the most recent, 98% of our patients say that we exceed or meet expectations. Okay, so some of them say professional care and personal warmth from all staff, a joy and huge motivation, which is key. The staff were fantastic, very helpful and accommodating. This helped with my progress. And I liked the rehabilitation care taken from the nurses and the lovely meals, like we said before. We also have a COVID-19 safety plan in place, but as I mentioned, we're also mindful of keeping connection with family. You can visit us virtually nowadays at any time. So if you give me a call, I'm more than happy to answer your questions and give you a virtual tour. If you want to join us at Metro, you can call me directly to discuss your rehab and your needs. My number is up there on the screen. After we've had a chat, if you feel like Metro is the place for you, you can get a referral from your GP or your specialist, and then fax the referrals to the number on the screen or complete the form online at metrorehab.com.au. Any questions? Please again, feel free to give me a call. Thanks so much for your time.